Hello and welcome to this afternoon's nonpartisan virtual briefing. I hope you enjoyed the pump up music as much as I did. I'm Alyson Northrup. I'm a senior policy officer at the Robert Wood Johnson Foundation, which is a leading national philanthropy dedicated to taking bold leaps to transform health in our lifetime. For over 50 years, RWJF has been a trusted nonpartisan resource for data and analysis that can inform policies to improve health and well-being in the United States. Today, we will provide an overview of the Congressional District Health Dashboard. This is a tool developed by the NYU Grossman School of Medicine in partnership with the Robert Wood Johnson Foundation. We know it's challenging to find data you can trust that quantifies the challenges facing constituents in your congressional district or state. That's why, in partnership with the NYU Grossman School of Medicine, we launched the Congressional District Health Dashboard in 2023. The dashboard now tracks 40 measures of health and its drivers by state and congressional district. Our goal is to provide actionable and nonpartisan data on critical issues, such as life expectancy, diabetes rates, uninsurance, and children in poverty, specific to your state and congressional district. Today's conversation will focus on how to use the dashboard to inform policy, constituent relations activities, and communications. I'm looking forward to our discussion. Before we dive in, a few programming notes. We'll have plenty of time for Q&A, so feel free to share your questions in the Q&A box throughout the discussion. A recording of today's discussion will be shared with you in a follow-up email, along with resources referenced during today's discussion. Near the end of our time, we'll share a link to a brief survey in the chat, and we appreciate you completing it. I also want to mention that for today's session, we have ASL interpretation thanks to Joseph and Kathleen, as well as CART transcription thanks to Joy. With that, I am happy to introduce you to our speaker for today, Dr. Benjamin Spoer, who is the Program Director at the Health Dashboard Initiative at the NYU Grossman School of Medicine. Ben and his team have played a crucial role in bringing the dashboard to life and continuing to grow and evolve it to meet policymakers' needs. Ben, welcome. Would you mind kicking us off by giving us a brief overview of the dashboard and its capabilities?
Yeah, Allison, thanks so much, both for the warm introduction and for reminding me of that headshot of a previous version of myself. Anyway, thank you all for joining us for this demonstration description of the Congressional District Health Dashboard. The challenge that the website was created to address is that until the website's launch, rigorous nonpartisan data on health and conditions that affect health were not widely available at the congressional district level. Some sources of data were available, including the US Census, which we have the utmost respect for. We use a lot of census data. And sometimes those data were substantially lagged and they were not available for all of the metrics that we thought were important to understanding health and health drivers. Slide, please. So the goal of the dashboard is to provide granular data at the district level in a straightforward and unbiased way to help inform and catalyze priority setting. And you see this quasi-logic model at the bottom of this slide. We want to reveal what's going on with regards to health in congressional districts, use that information to inform, and for some to hold accountable the systems or policies that we hope will result in health improvement. Next slide, please. So the Congressional District Health Dashboard, you see a national map of congressional districts. We have 40 measures of health and drivers of health across all 435 US congressional districts, 50 states, and Washington, D.C. to help inform priority setting and drive action. You can see the URL underneath the US map. And we developed the website in partnership with the Robert Wood Johnson Foundation and have relied on close collaboration with the Bipartisan Policy Center, and Center on Budget and Policy Priorities to guide us and get the word out. Next slide, please. So this is a lot of text on this slide, but what it boils down to is here's the list of metrics you can find on the Congressional District Health Dashboard. What you'll notice is some have an asterisk denoting that population demographic breakdowns are available for such metric. And the one with the triangle, the sort of delta sign, have census tract data available. And census tracts are a smaller geography meant to approximate neighborhoods, and they're available for some of our metrics. You'll also notice that they're distributed across 5 domains meant to really capture the social drivers of health, health behaviors, clinical care, the physical environment, and of course, health outcomes. Next slide, please. We are pretty careful about the metrics that we add to the website. We don't want to overwhelm folks with 100 different metrics. We try to keep it around 40, still a large number, but there's a lot to measure in the health world. So we try to make sure that the data we present are based on national data sets, so every place on the map can be represented, that there are rigorous methods underlying the original data collection, that they reflect public health priorities, that you as policymakers can do something about this metric that is amenable to intervention. It's balanced across 5 overarching domains, and that it's regularly updated. We really aim for annual updates, if not more frequently. Next slide. So I'm going to describe a little bit of, well, a lot of the work we've done since our launch 2 years ago. One of the areas we concentrate most on is adding new metrics to the website. These are the 7 new metrics we've added since launch. I'd like to focus especially on food insecurity and Medicaid enrollment, which have been especially relevant recently, and also independent living difficulty, which is a measure of disability we recently added in our end of February data release. Next slide, please. We also added a number of new features to the website. My personal favorite as a maps guy is the address lookup, because not everybody knows their congressional district off the top of their head. We added links to the cities and congressional district to our other website, which I'll tell you about. Demographic sense making to help help people more easily understand our demographic breakdowns. We added state data to make the website more relevant to the Senate. We had the ability to compare districts and downloadable scale maps and scale bars so that if you want to, you can include some of this data in a presentation easily. Next slide, please. In our annual data updates, we try to update our data to the most recent year of data available, which is usually all our data can be updated. We also are able to create metric estimates for newly redrawn congressional district boundaries. So the data on the website today represents the 119th Congress congressional district boundaries, which for some places were redrawn. And we really believe that this is what most accurately represents the health conditions in congressional districts, because these boundaries are often redrawn to better represent the people living in these places. So we think it's an important data validity commitment that we make. Next slide, please. So I'm going to give you a brief demo of the site through these screenshots. If you were to log on to the website right after this demo, using the URL on the bottom here, this is the landing page you would see. You'd be able to look up your congressional district or state, or if you wanted to use an address or zip code, you could use that below search bar. Next slide, please. So we've decided to focus on Maryland's 8th district today. And this, if you type in your address or congressional district, this is where you go next. And a couple things I want to highlight about this page. First, you get all of our metrics in alphabetical order. Right next to the metric name, you see an estimate for the congressional district you've selected. Next to that, on the right-hand column, you see a little indicator that tells you whether the district is doing about the same as the US, or a little better, or a little worse. So Maryland's 8th is doing better on broadband connection, a little bit worse on prenatal care, and around average on air pollution. On the left-hand side of the page, you can also filter by domain, and you can access some of our documentation. Next slide, please. So this is the District Facts tab, which you can navigate to by clicking on the tab next to Metrics Overview on towards the top of the page. And you get a little more information about the district population. You get a breakdown by race ethnicity, you get race ethnicity, you get a total population count, and a breakdown by age. Next slide, please. Here, if you scroll down to the District Facts page, you get a link out to the City Health Dashboard via the cities located in each congressional district. So here in Maryland 8th, we have 6 cities that are on the City Health Dashboard. Not every city in the congressional district is on the City Health Dashboards. We don't link out to every city. But if you are working closely with folks in a congressional district and they say, I'm in Rockville and I'm really concerned about teen births, then you can go to the Congressional District Health Dashboard, look up your congressional district, scroll down, click out to Rockville, and get data specific to that city on the City Health Dashboard, which is the other website our project produces. Next slide, please. And if you scroll down further, you'll find the members of Congress that represent the district you're looking at. Next slide, please. So this is our metric map. This is a map of the whole country. We're looking at rent burden, which is what percentage of folks are paying more than 30% of their income towards rent. And you can see a congressional district level map in the center here. You can also select a specific metric by clicking on, a specific district by clicking on it on the map. You can change the metric on the left-hand side. You can, on the left-hand side, search for a particular district, which is especially helpful in places with high population density, like parts of Texas, California, and New York Northeast. And it's hard to click on a district without zooming in substantially. You can change the metric year, and you can also download the map or scale bar for use in presentations. Next slide, please. So this is the congressional district view of the metric map. We're still in the Virginia 8th. We are now looking at rent burden in Virginia 8th. And what you can see is we've also depicted the congressional districts surrounding Virginia's 8th. So you can get a quick understanding using the scale bar on the top there, which what variation in the local area there might be in the rent burden metric estimates. And we still on the left-hand side have the ability to switch districts, to change metrics, to change data year. You can change from the comparison value from the state or the US average, right? So you can say you can ask how Virginia 8th is doing compared to the state of Virginia or the US average. And then we also have the ability to show census tracts for some metrics, and we'll go to the next slide to show that. So this is the census tract level map of congressional districts. And my guess is that if there's anyone in the audience from Virginia 8th, you're looking at this and thinking to yourself, oh, well, these light spots correspond to this area, and these dark spots where there's higher rent burden correspond to this other area. And there's this sort of prima facie, you know what's going on here. You can click on the different census tracts to get the specific values. And you can also, if you know the census tract number you're looking for, you can put it in the search bar on the right-hand side. If you know census tract numbers, GeoIDs by heart, please email me. I want to get to know you. Next slide, please. So we also provide demographic breakdowns for some metrics, the metrics you see underlined here. Next slide. So this is what the demographic breakdown looks like for high school completion for the District of Columbia. And you can see that in this top section, we have high school completion by sex, and the numbers are pretty similar across male and female. But on the bottom here, we see that there's some differences across race ethnicity, Black folks being a little bit lower than Asian folks. And that's the strength of demographic breakdowns. It helps you see differences across these demographic groups. Next slide, please. We also provide sense-making statements for these breakdowns. So instead of trying to figure out exactly what the website means by 92.8%, you can read this sentence under the scale bar and, under the bar chart, and figure out what that number is telling you. Next slide, please. This is the compare districts feature. If you look on the left-hand side in that box, we've put in a whole bunch of different districts. We've got DC, Virginia 8th, Maryland 8th. And the website has populated values for broadband connection, another one of our metrics, for all of these districts. And so you can get a quick idea how the district you're interested in is doing, not only compared to the US average, but compared to other districts that you may often compare yourselves to. Next slide, please. You can also visualize the district comparisons via these cards, which may be easier to digest or more aesthetically pleasing than the bar charts. They'll appear in the order of that they were entered into the search bar. Next slide. This is our metrics background. We have detailed information on how we calculate our metrics for every metric we calculate. Next slide, please. This is the metric background page for food insecurity. What you get here is how and why we measure this, what our data sources are, what our year of data, and how the metric is calculated. We want you to be able to see what we're doing because we value transparency and because we believe that transparency leads to trust. And we want you to be able to trust the data so you can use it with confidence. Next slide, please. You can also download all of our data. So as you can see here, we have a data dictionary where you can get very technical about the downloadable data, what's in the file you get when you download it. We also have technical documentation, which has a deeper level of information about our metrics and methods than you get from the metric background pages. And once again, if you're a person who really wants to read the technical document, please reach out to me so we can talk because we love people who read the technical documentation. We almost have a bell in the office to ring every time somebody says they have read it. And next slide, please. And this is a final slide here is how we have set up our data download feature. It used to be that you had to use a application programming interface, an API, and enter some code and get a token, and it was difficult, more difficult than it needed to be. Now you can select some metrics and some states, or you can include all the states if you want to. You can also get census tract level data. But the point is that anyone who has gotten this far on the website can also download our data and use it in your own analysis if you so choose, with the help of the data dictionary. So that's the walkthrough of the website. I just want to say that we have created this in the hopes that it makes it easier to use data in your day-to-day life. And so if you see this and you think, man, it's great, but we really need this other thing on it, or it's not so great and here's why, please drop in a question or reach out. You can email us at our info@email, which we'll put up soon. We want to hear from you. Thank you.
Thanks, Ben, so much. I always learn something new whenever I hear Ben or the other folks at NYU talking about the dashboard. I have a small confession to make. When I used to type in Congress, like start to type it in on my web browser, it would default to congress.gov. And now it defaults to Congressional District Health Dashboard.org. That is how often I'm visiting this site, and there are always new things that I'm discovering about what you can do with it, what information is available. So I'm a clear booster for the site. So as everyone else has now seen, it has a ton of capabilities. The demo is super helpful. I also think just kind of browsing yourself is a really great way to figure out how you can use it and make sense of it for your work. I'd love for Ben and I to talk a bit now about a bit more about how policymakers in particular can use the tool to inform their work, thinking about our primary audience. I know it's not our exclusive audience on this webinar, but folks who are working in Congress and how they might think about how to use this tool in their work.
So Alyson, what I'm hearing is how have we seen policymakers use the data in their work? Is that right?
Yeah, that's great. If you've heard of some case examples of how policymakers have used it, that would be wonderful to hear.
Yeah, totally. So we are hearing more and more often about policymakers involving our data in preparing for hearings or during hearings, saying, we are thinking about this important issue, and we grab these data about it from the Congressional District Health Dashboard. So in a lot of recent conversations about budget, we've especially seen a surge in visits to the pages related to the Medicaid enrollment data, which is the percentage of the total population by congressional district enrolled in Medicaid. Um, and we think that's probably related to some of the ongoing budget conversations. So we'll often also get forwarded an email or sometimes copied on an email by someone saying, we use these data to help prepare this brief, and now it's going to be used in this meeting or this conversation that's sort of pivotal to policy decisions.
That's great. I'll say as a former Hill staffer myself, I wish that I'd had access to the dashboard. When I was working on the Hill, I could see it being really useful for, oftentimes you have to kind of quote unquote get smart on an issue really quick and understand how a particular issue impacts your boss's district or state. And it's just that just the right level of information. You can always go deeper. That I find incredibly helpful for seeing, how does this issue show up in my district or my state, and knowing that the data is reliable. Um, and I'd actually, we can transition to some audience questions, but I know that one question I would have coming to the site is, without diving into the technical documentation sheet, um, generally, where are you pulling this information from, and how do you feel confident that what you are putting out into the world is reliable and accurate?
Yeah, so the tech doc is only for the brave. And I totally get it. Our primary data sources are the U.S. Census ACS American Community Survey, the CDC Places project, in which they use some statistical modeling techniques to take county level data from the behavioral risk factor surveillance system and sort of aggregate it downwards into census tracts. And then the National Vital Records and VSS. And so these are well maintained, carefully analyzed national federal data sets, right? And so we believe in their rigor. We do review the methods and try to stay up to date on changes with the surveys. But those are our three major data sets. Some of our metrics will come from other data sets that we quite frankly are very careful with because we want to make sure they hit our rigor standard. And then we do an internal validation process on everything we release, in which we're looking carefully for values that are counterintuitive or that change in a big way year to year, right? And sometimes there are big changes caused by secular trends, something in the real world. And sometimes big changes are caused by data quirks, and we work hard to try and suss those out. And where necessary, we'll not put data up if we don't have total faith in it.
That's great. And so folks are already submitting questions through the Q&A box. Please keep doing that. We're going to get to as many as we can. And you can do that in the Q&A box again. So I'm going to start off with first question from an audience member, which is there any way to get more granular than looking at the data from a congressional district level? That is to say, can the dashboard identify disparities within a congressional district that may be racially or geographically diverse?
Mm-hmm. It's a great question. The straightforward answer is yes. We showed the census tract maps, and census tracts were created for statistical purposes by the U.S. Census. Part of the way those boundaries are drawn is to approximate neighborhoods. And so we use them on the city health dashboard to provide an idea of what's going on within cities. We also provide them on the Congressional District Health Dashboard to provide an idea of what's going on in a geographically granular level within congressional districts. And you can, if you look carefully at a census tract map of a congressional district, you can probably pick out, oh, like I know that this area is a certain neighborhood in a certain city where I expect rent burden to be higher, or here is a certain neighborhood in a certain suburb where I expect that people can't walk around as much. They're not great sidewalks, so maybe I'll expect these other health outcomes. We sort of provide the data humbly without interpretation and leave it up to the local experts, that's you guys, to interpret it, though we of course are standing by to help with any technical aspects.
Great. A foundational question about the dashboard. Does access to the dashboard require any payment or subscription? That was the audience question, and I'll just add on, what about downloading the underlying data? Does that cost anything?
Yeah, thanks to generous support from the Robert Wood Johnson Foundation, we can provide it all for free. We've never charged anybody anything. I would even say that we provide free technical assistance to people who need it. So if you email us because you're like, man, I can't figure out how to download. Ben said it was so easy, but actually it's not to download this stuff. We're going to help you out. We do custom data cuts for people. We also really do enjoy working with folks who are using the data. So if you're trying to use the data for something and you're like, man, I need it for this purpose and I'm not sure it's right, we can give you all the information you need to make an informed decision.
That's great. So it is not just a dashboard. It is, in fact, several really brilliant people who want to help make the best of this tool, and they should be reaching out to folks at that initiative.
Exactly. Exactly.
Okay. That's great. A question from Lindsay. Any information on disabilities and or types of disabilities in a community that are reflected in the dashboard?
Yeah, great question. Lindsay, yes to disabilities, no to types. We added at the end of February a measure of disability called independent living difficulty, which is folks who reported to the census that they had trouble because of a physical or mental impairment conducting daily errands on their own. And if you're asking this question, you probably know this, the census provides something like 7 or 8 disability metrics. And we talked to some experts that we knew at our institution, and they said that some of the other disabilities have other advocacy groups getting the word out about them. Independent living difficulty could use more visibility, and we thought it was really important to get a disability metric up, and so we chose that one. We're of course willing to hear other opinions or suggestions that we add more disability metrics.
That's great. And maybe we'll get a follow-up from Lindsay too. So there was a mention in the Q&A about the dashboard recently added several new metrics, and you walked through them, Ben, in your demo, your presentation. What is it? What's the process for selecting a new metric? And I know you mentioned like 40 is a lot and we don't want to grow much bigger, but could you see adding additional metrics in the future?
Yeah, so we always almost every year, definitely every data release, every year we add new metrics. We also sunset some metrics. An example is on the city website, we had a COVID local risk index that we took down when the COVID national emergency was concluded. So we try to, it's sort of an open group, some exit, some enter. The life cycle of a new metric usually starts when someone suggests something to us, right? It might be Alyson saying, put up a Medicaid metric, maybe. It might be someone from this webinar emailing us with an idea. It could be one of our faculty experts suggesting something that they think is a public health priority. Then we go out and search for a data set. And a lot of times a potential metric will get crossed off the list because there's not a good data set, or because we discover that the way it's measured or the concept itself is not particularly actionable. If it can make it through that, then we put it on in our next data release.
That's great. And I can say from experience, so I go to the Hill and meet with staff and meet with members and often bring dashboard one pagers about a district, about a state. And in probably about 50% of the meetings that I take, folks are like, have you ever thought about including X metric? And I always take that back to the folks at NYU for you guys to consider, because it's what's most, if I'm hearing about it from Hill staff, it's relevant to their work. And there's not always the data set available or the rigor, right? But we do want to hear about, what are the metrics that are going to really help you understand health in your district or in your state.
100%.
So I love this question that we got from an audience member. Can I subscribe to a measure and get notifications when that measure is updated? What a cool idea. Does that exist? Can we do it?
We don't currently have the ability to subscribe to a specific metric, though it is a very cool idea. We have a newsletter, and we of course announce the data releases, both the big annual release at the end of February and then the 6 months later typically in August, we have a mini release. But it's easy to ignore a newsletter when you've gotten it, 11 times and it's only the 12th that has the thing that you want. So I might bring this back to our web development team and see if they have an idea as how to ping people when the thing they care about most has new data.
Are most of the metrics updated at the same time
Yeah.
in a cadence?
Yeah, if you want to put a date in your calendar, it's probably the last day in February each year. So most of our metrics are annual metrics. It'll be a 2023, 2022. Some metrics have more temporally granular data. So for instance, the Medicaid metric is quarterly. And so we have a mini release in August to fulfill the potential of that metric to be updated more frequently. But if you're interested in one of those annual metrics, it's like I would put the last day of February, and if the data is not updated by then, you can send me an angry email and I will apologize.
I love the humility. Is there a fairly standard lag time, period of time? Like how fresh are most of these metrics?
Yeah, most of these metrics are 2 to 3 years old, and it takes a tremendous amount of time and effort to collect information about a place as big and diverse as the US. And I know that the folks collecting the data are always trying to speed it up. We are working on fancy math techniques to use information we have to project the present. It's a sort of a strange thing to say, but we want to try and describe the present using data from the recent past. So we're always trying to make it more recent, but unfortunately, we are looking at a 2 to 3 year lag on most metrics.
Okay. And keep us posted on how predicting the future goes. I'd love to know. Okay, a specific question from an attendee. Does the dashboard include data from Wyoming? I assume it does.
Yeah, we do have Wyoming on the Congressional District Health Dashboard. I've actually got the website in front of me, so I'm going to type Wyoming. Wyoming is, as I thought, one of the at-large districts. So the district and the state values are the same.
Yep.
As the attendee surely knows, but it's on there.
Okay, great. I would feel very disappointed if I would be chastising you if you had left Wyoming out.
You should.
A question about, so aside from using this data to inform policy work and maybe targeting policy interventions based on what's happening in your district or your state, how else can the dashboard be used in congressional offices to promote health? For example, through constituent casework or media outreach.
Mm-hmm.
If you want to field this one, go for it, and then I can offer some reflections.
Yeah,
too.
I was about to say, I'm really interested in your thoughts, Alyson. On the sister website, City Health Dashboard, we've learned a lot about how people use the data locally. And I know that congressional district offices will often do community level outreach, right? And so if you are looking at this, especially the census tract level map, and you're thinking about a health fair or a outreach program, you'll be able to tell where historically different health outcomes have been more or less common. And that might help you geographically sort of guide where you want your outreach to go. We also have examples of people in the research world saying, I want to find folks who have this health condition. Where does it happen most? So they go recruit study participants. So if you're thinking, man, I really want to talk to folks who have high rent burden or spend a lot on rent or don't have broadband, you can find the neighborhoods where those people are more likely to be found.
Yeah, that's really helpful. So from a both a constituent outreach and a media outreach perspective, I can see the dashboard being a really useful resource. So just going back to my Hill days again, I can remember for like press releases, you wanted to localize an issue, right? Like say your boss had a bill specific to breast cancer, wanting to talk about that bill and talk about why that bill is relevant to your district or to your state. So being able to provide that level of information for if you want to, do events in a specific county within the district, being able to have both the data and you're probably, you have relationships with the local organizations and leaders. But I always find it nice to kind of pair it with what does this look like? What does the data show the impact of this issue is in my district, in my state? Let's see. We have so many questions. This is so good. Okay, this is a good one. Ben, are there trends that you have seen, interesting trends you're seeing in the health data over time in one specific metric, something that has stood out to you since the dashboard launched 2 years ago?
That's so interesting. On Congressional District, we have seen overall Medicaid enrollment decrease, which I'm not an expert in that policy realm, but my guess is it's related to unwinding. Some other people who are experts have said that. We do see some continuing increase in chronic disease, and we are just about to start analyzing life expectancy data. And I'm really interested to sort of try to go back in time on life expectancy because it's a huge topic of concern in the public health world, where a lot of my team and I work, because there were big declines around the opioid overdose crisis and also around COVID, and then it has sort of stagnated, right? We're not backsliding, but we're also not making advances. And one big hope is that if we make informed policy decisions, we can start increasing life expectancy. And it's a really effective totalizing metric of the nation's health.
So I've looked at the life expectancy metric and I remember it feeling a little bit wonky. Is that right? What is the life expectancy metric? This is a pop quiz.
Yes, Alyson. So I don't know if the production team can put on the Jeopardy music, but I'm going to do my best. So the life expectancy metric we have on the website is old. It's like 2015, right?
Oh.
And it's like a lot has happened since then.
Yes.
COVID, right? The reason it's so old is because we're able to get a census tract level estimate right down to those little neighborhood units. It was a project through CDC where they had data sharing agreements with all the states. Census tracts are pretty small. And so to get access to death certificates with that level of geographic granularity, you have to do a lot of careful data privacy work. And we've heard some indication, but nothing conclusive, that they're going to refresh those data. In the meantime, we're working on ways to do that analysis at a larger geographic unit. We're looking at the city level right now. Hopefully soon we'll do it at the congressional district level so that we can get more up-to-date data, but at a larger geographic unit, right? And so this is the tension in the data work versus the privacy work, is that it's vital at all costs that we protect people's privacy. And in order to do so, we sometimes must sacrifice the geographic granularity of the metrics that we know is so important to accurately guiding policy. So we're looking to provide updated metrics. We're hoping to get an update on that specific project soon. And you're right that it's a little wonky.
Got it. All right, we will stay tuned, I'm sure all of collectively on this webinar. Okay, one final question for you from an attendee. Can you compare, this is a technical question about using the dashboard. Can you compare two different date ranges for one district?
Oh man. I don't think we have multi-year trends right now. We might. The best way to do that, and you can see me clicking around the site right now. The best way to do that is to download the data, because you can get the data for multiple data years, and then do those analyses yourself. And if that just sounds like an awful experience, it's like I'd rather go to the dentist, email us and we'll do it.
And you'll do the data crunching. Okay,
Yes.
that's helpful. That was a great question. So with that, we are coming to the close of our session. I want to extend a huge thank you to Ben for walking us through the dashboard and helping us make sense of all the amazing capabilities of that tool, sharing his insights and expertise. I want to thank all of you for participating in this discussion and coming with your great questions and curiosity. We appreciate your time. We appreciate your interest. We have put a link in the chat officially now for a brief anonymous survey. We appreciate you completing it to help us plan future events to make them most relevant to you and the kind of information and analysis that you need. We'll provide a recording of this webinar and a link to the survey as a follow-up email. Thank you so much and have a great rest of your day.